The remedy that we are going to discuss today is a very important remedy, and we as homeopaths we commonly use this remedy in our clinics. Okay, so it is one of the polycrest remedies. Okay, as a final year student, by now you understand what a polycrest remedy is. Okay, now what is a polycrest remedy? One thing is it's a defective remedy. Agreed. Then. Okay, it acts on different areas. So you'll have a wider range of area. Okay. So for example, from your first year syllabus, you have so many polycrest remedies. That can I have a few common yes, sulfur, arsenicum, very good, agreed. Silesia, yes. Natrium venaticum, beautiful, good, correct. Gelsemium, okay, gelsemium. Naxonica, yeah, absolutely right, Naxonica. Okay, Ignitia. Arsenicum, okay, arsenicum was just given. Fine. So we look at one more remedy. Now before I tell you this remedy, or before we unveil the title of the remedy, we'll have a small discussion. What are all the common sources of homeopathic material, America? Plants, minerals. Okay. See, you are confusing it with pharmacy. Yeah, very good. Sarcores and nosores, they're part and parcel of materia medica, but they're not the source. So my question to you is, what are the sources from where you have got this, huge symptoms? Okay, drug proving. You are talking about clinical, you are talking about toxicological, yes. Accident, very good, absolutely right. Accidental. Okay, accidental, then anything else. You have some 10 to 13, a huge list. Okay, empirical, very good. One of our friend is referring our notes. Okay, empirical. Empirical, okay, then one more, simple. This was introduced by Paracelsus. Yeah, very good, beautiful. Doctrine of signature. Okay, now what is doctrine of signature? So you understand the remedy from its external appearance. Okay. Now, so what is that you understand from the external appearance? Can I have some examples for doctrine of signature? Okay, carrot for eye, very good. Euphrasia for eye, okay, good. Beetroot for blood, good, agreed. Walnut for brain, okay. So if all of us start eating walnut, then, so, yeah, at least now that you have your exams coming close, so eating more walnuts, as per doctrine of signature, not as per me, as per doctrine of signature, we should do wonders to our college, to our students. We should get better results. So that is what doctrine of signature says. Okay. So we have already taken this topic, so I am not going in detail about doctrine of signature. But what I want you to understand is relationship between the external physical properties of the drug substance and the signs and symptoms present in the patient. This is what we call as doctrine of signature. Okay, you know this. Now we are looking at one remedy. Okay, which has lot of information, and this information has been gathered from doctrine of signature. Okay, so the remedy that we are going to discuss today is Pulsatilla, and I'll not read this. It's called wind flower. I'll just give it to you in a gist. Now, what do you understand by wind flower? I'll also show you the plant a little later, the image of the plant. But looking at the plant, you realize it's a very thin plant, and this is a plant which keeps moving as per the direction of the wind. Okay. Now, what could be the symptoms that will be present in the patient, keeping this piece of information that this is a plant which constantly keeps moving as per the direction of the wind. Okay. So what could be probable symptomatology that you might express or you can expect in the drug picture of Pulsatilla? Very good, they can be very changeable. Why changeable? Because as the wind is blowing, the direction of the wind, the plant also keeps going. The wind is this side, as it comes this side. Okay, so what you need to understand is this is a plant which is not very firm. So you will be surprised to see the mind of Pulsatilla, or you can also be surprised to see the physical symptoms of Pulsatilla which are very changing. I'll explain this. So the common name of Pulsatilla is wind flower, and then it's also called it's pulsating with the wind. So that's why wind flower, and it is the name Pulsatilla is derived from the Latin word pulsate, meaning to beat or to strike. The flowers pulsate from the growing winds. So the name Pulsatilla. Okay? So they are giving you the meaning. How did the word Pulsatilla come up and what exactly it means? See, this information practically may not be very useful. But for us to build up the drug picture a little later, this information can be useful. And that is what we'll be doing a little later, that we'll be trying to integrate. Okay, I'll come back to it, and then, it was introduced into homeopathy in 1805, and the credit for proving this beautiful remedy goes to our founder, Dr. Nigricans. Okay, and this is Pulsatilla nigricans, beautiful plant, and this is how it looks. If you just see the plant here, you realize that it is not a firm one. It's a very lean, thin, and it is not, this is something which can be very shaky and it keeps moving as per the wind. Okay, and wind flower, meadow, anemone, and pasque flower are the three common names of Pulsatilla, which can be a viva question for you. What are all the common names of Pulsatilla? Now we'll look at the deeper thing, the more important thing. Till now whatever I have told you is nice to know. Now we'll look at the important aspect of Pulsatilla. So you got the common name, it's pasque flower, wind flower, meadow anemone. And I told you the prover is Dr. Anemone. And it belongs to the family Ranunculaceae. A remedy or a plant which belongs to the family Ranunculaceae. Okay. And it's a polycrust remedy, it is a deep acting remedy. So this is information, basic information you have got. Now we look at the sphere of action of Pulsatilla. Where do you see Pulsatilla active? Right? You have the image taken from Google, and you see that Pulsatilla predominantly acts on the mucous membrane. Okay? Almost 45 plus remedies done for you, and many remedies acting on the mucous membrane. Okay? So which are the common remedies? Ailments, we discussed this. Gelsemium, aloes, Arsenic amalgams, correct? Absolutely right. Simple remedies. Brainy alpha. Okay, which mainly causes dryness. And I also explained in some class, each remedy acting on a specific part, based on its affinity, it can produce a lot of things. Okay, arsenic acting on the mucous membrane produces ulcers, inflammation, ulcers. And Ailments, it can cause simple inflammation. Brainy can cause more of dryness. Aloes can cause increased mucous secretion. Okay. So what is Pulsatilla doing acting on the mucous membrane is very important. Huh? So Pulsatilla, this is a very important and a vital area, and understanding sphere of action will help us understand the particular symptoms very well. So your kind attention, and you need to focus on this particular area. So mucous membrane, what exactly Pulsatilla is doing? It causes mucoria. What is it? Mucoria. Okay. Now what is mucoria? Mucoria is nothing but increased mucus secretion. So after some time, when I am talking about nose, when I am talking about eyes, or when I am talking about any part from your knowledge of anatomy where you have mucous membrane, you can confidently talk of Pulsatilla increasing mucus secretions. Mucoria, very important. Okay. Now the second area, apart from that, you also see this acting on the eyes. Again, the mucous secretions are increased. We'll elaborate more in the particular symptoms. And then you also see this acting on the ear. Okay. Here you can see two very important actions. One is pain. Okay. What is it called? Very good. Otalgia. Good. Keep it up. Otalgia. Or I gave you a slide before this. It increases secretions. So what is that secretion that is coming from the ear called? Otorrhea. Okay. So two very important things. You see pulsatilla causing here is like, for example, you can have otalgia or it can also give rise to deafness. Okay. Yeah, so this is again the nasal mucous membrane, the sinuses, which it can affect. The GI, the gastrointestinal tract, we are starting with the stomach, mucous membrane of the stomach, and again, it causes increased secretions. Okay, and it's one of the top remedies for indigestion. It can cause weak digestion and it can also cause indigestion. In bryonia also you see indigestion. Can somebody quickly tell me what happens in bryonia? Very good. Dryness of? Beautiful. Good. So?
It can't mix with that history.
It can't?
Its secretion will decrease so that it becomes hard. That's why.
Okay. Can somebody, it's absolutely right. I have got nothing against you. But can somebody make it more clear? Very good. Correct. Yeah. See, she has got a point. And if somebody can pick up the clue that she has given, you can, connect the dots. So what she is trying to tell us, as I understand, bryonia is a remedy which is causing dryness. So what is happening? Knowledge of physiology, the gastric secretions in bryonia gets decreased. And gastric juice is very, very important for digestion. So when the gastric juice is decreased, the digestion is not happening properly in bryonia. And that's why bryonia has that sensation of stone in the stomach. Because the food is not digested, so they feel that sensation of stone in stomach, in bryonia. Okay? So we'll move forward and we'll see, you'll understand that acting on stomach it causes indigestion. I'll explain more on the stomach. ಈಗ ಸತ್ಯಕ್ಕೆ indigestion and the lower bowel. I know you can give me better remedies. Which are the other remedies acting on the lower bowel? Lower bowel. Aloes. First remedy is aloes. Yes, very good. Naxwamica, absolutely right. Aloes, Naxwamica. Then is Natrum salt done? No problem. Arsenicum. Okay, Arsenicum. Then Naxwamica. Podophylla. Is that done? Very good. Podophylla. Chamomilla. All the diarrhea remedies, dysentery remedies. Talking about dysentery, you should immediately think of another remedy, and that remedy is colchicum. That's there in your So colchicum, all these remedies. You also have pulsatilla acting. See, after some time you realize, though all these remedies are acting on the lower bowel, the effect can vary. That's what we'll try to understand a little later. So it mainly causes diarrhea, and the character of diarrhea you have in pulsatilla is mainly mucous diarrhea. Okay? So we'll go ahead and what remedies come to your mind looking at the image? Very good, gelsemium. What do you see in gelsemium? Good. I'm happy you thought of gelsemium. Because I did gelsemium. Very good. So gelsemium you see mainly incontinence, which is the result of paralysis. Good. Any other remedy apart from gelsemium? Very good. Epismelifica. See, in apis you see more of inflammation. In gelsemium you see more of paralysis. Mainly the bladder. The bladder. Okay. The bladder muscles, the sphincter, they go into paralysis. So you either see retention or you see involuntary urination. Very good. Good. Okay. So apis causing inflammation. One more remedy. Okay, natriuretic. What happens in natriuretic? What is it? Who's there? Yeah, what happens in natriuretic? Good, correct. Okay, so in natriuretic, we are talking of gelsemium. In in which there can be involuntary urination. So the issues with natrium urine is especially in public places. Natrium cannot pass urine. Can't pass urine in public places. Okay. Whatever physiology you are told now, the contraction, the relaxation of the blood muscles, all those things will go for a toss in natrium when somebody is present. Fine? Okay? So cannot pass urine in public places. Natrium urine. There might be many reasons why they are not able to pass urine in public place. One reason is hygiene. Sir, it's very dirty. And second reason is, there is also some amount of embarrassment in natrium. That is why they are not able to pass urine in public places. Okay. One more remedy, kidney. Very good, acconate. Good. What happens in acconate? Retention. We discuss acconate. Acconate infants can have retention of urine. I told you once he comes out, he sees this bad world. Where am I? And he goes into shock, and then there is retention. Inside the room, he was very comfortable. Once he comes out, fear, shock, acconate. Good. Then any other remedy? A simple remedy. Again you are missing the remedy. Very good. Who was that? Colchicum. What happens in colchicum? Inky urine. Urine gets concentrated. Colchicum is a beautiful remedy for gout. There is uric acid metabolism which is getting affected, and you can see colchicum getting indicated for gout. Colchicum. Okay. So illy you see mainly inflammation, and then there is mucus in the urine. Again, pulse we say is predominantly a female remedy. Pulse is predominantly a female remedy. But I have shown you the male genitalia from the basic knowledge of your anatomy. Okay. So what you see is pulsatilla mainly affects the testis. Pulsatilla can affect the veins, and it mainly causes arthritis or inflammation of the testis, or it can also cause varicose vein. What is it called? The pempiform plexus, if I am right. My anatomy is very old. Okay, pempiform plexus. Those things get dilated, and we call this as varicose vein. Clear? Varicose vein. So moving further, these are what we call it as dilated veins, varicose vein. Okay, the last area, this is very important. The last area and more important what you see here is, it is a remedy which has an affinity for the female. Name the organ, you see it affecting. It can be the ovaries, the fallopian tube, the uterus, the entire female genitalia. You see this particular remedy acting. Okay. Now, it can cause inflammation, and you will see a lot of menstrual irregularities in pulsatilla. It can be late, scanty. And what was the basic doctrine of signature of pulsatilla? Changing. So it can be late, scanty menses, or it can be early, profuse menses. So the changeability is very important in pulsatilla. Okay? Fine. And in general, see what you have to realize here is, see it's got an affinity for the veins related to the male genitalia, and I was also going one step further, and I was trying to tell you this is a remedy which has an action on the veins in general. Okay, so what you also see is pulsatilla can be a very important remedy for varicose veins. Very good, keep it up. Varicose veins. So veins, male, female, mucous membrane, gastric, okay, kidneys. You will see pulsatilla acting on the majority of the structures, and that's why it is called a polycystic. Very good, keep it up. So we'll go ahead, we'll be a little quick so that we can cover the remedy, and we'll also try to have frequent interaction so that you understand what I have told. Now, what is this that you see here? Tea. Now, why did the image of tea come up here? Because we are looking at a headache called as ailments now. Now the heading that we saw a little while ago is sphere of action. Now we are looking at ailments from. What are all the causative factors? Pulsatilla has issues with tea. Okay. After tea they might get headache. After tea they might have gastric problems. Vertigo after tea. These are all the possibilities in Pulsatilla. So ailments from drinking tea, one, and then second you also see ailments from eating pork. Naವೇನು ಕಾಡದಲ್ಲಿ ಹಂದಿ ಮಾಂಸ ಅಂತೀವಿ. Fine? Ailments from eating pork. Okay. Third, generally ailments from eating non-veg. Non-veg. See, Pulsatilla has issues with spice. Pulsatilla has issues with masala. Exactly opposite to Naxxamica. Naxxamica loves spicy. Many times we go to hotel now, the chef or the waiter, they come and ask, how do you want? You want more spicy? You want less spicy? For example, if it is Naxxamica, if it is fluoric acid, if it is phosphorus, if it is sulfur, then you will tell the chef more spicy. Fine? And if he is Pulsatilla, then he will say less spicy. Because the moment he eats spicy food, he has to run to the loo. Okay. So Pulsatilla generally, I mean our North Karnataka or Andhra, we are all known for spicy. And people who come to our place, they might have issues. We have heard, you North Karnataka people or you Andhra people put more spice. For me, please put less spice. Why? Because I am Pulsatilla. Okay. Right? And there might be some friends who might be coming on to your house only because you prepare, your mom prepares more spicy food. Nam kade khara jaisa andre adhikara nim kade bandide. They are not Pulsatillas. Pulsatilla might love spicy. Fine, but Pulsatilla will have problems eating spicy. Okay. So ailments from spicy, fatty food, rich food. If you want me to be more specific, cheese, butter, fat, these things they have issues. Ailments from ice creams. Okay. Ailments from bakery stuff. We call it as pastries, cake, biscuits, bakery things, cream, pastries and bakery stuff, cakes. Okay. And you can also have ailments from ailments during pregnancy. I'll share my wife's case a little later. When I was talking to you about, I don't know if I've told you before, but rarely I get a chance to talk about pulse. Now that it's been given to me, I'll be sharing a beautiful case of my wife. What exactly happened. Let's have some surprise. You keep. I'll not share it now. Okay, let's come to that component of Pulsatilla, and there will be a small element of surprise. What is Vikas are going to tell about his wife? Okay, so let there be a small surprise. We'll discuss that and see, complaints during pregnancy is one part, and Pulsatilla has problem tolerate iron. Complaints after iron. Okay, iron tablets. Okay, and getting feet wet. You have heard of getting wet remedies? Dalcamera, very good. Okay, arsenic also. See, arsenic is that beautiful remedy. Any question your teacher asks, you can confidently tell arsenic. Don't shy away. No, tell confidently arsenic. Fine, and it will somehow fit in. That's the beauty of the remedy arsenic. Okay, we'll come back. So your friend was talking about Dalcamera, he was talking about arsenic. Getting wet, Ailments. Getting wet, you also have rest-offs. Fine, you also have rest-offs. You also have Quachicum, getting wet. I don't know, some more Quachicum is coming too many times. Fine, and here it is specifically getting feet wet. For example, in swimming pool, you sit and you keep your leg in the pool, getting feet wet. Okay, or only your feet is getting wet. That will become leg, only your feet getting wet, and then you have problems. Especially girls having amenorrhea. What is it? Girls having absence of menses after she getting her feet wet. The remedy is Pulsatilla. Sir, every month I am very regular with my menses. This month, menses has not come. And if you dig deep in and if you ask why it is not there, and then there may be a possibility of she telling or you concluding that she got her feet wet and then there is absence of menses. The remedy is Pulsatilla. Okay? And complaints from thunderstorm, complaints from, see these are all physical elements that we are looking at. Emotionally also you will see a lot of things. Complaints from fear, fright, anger, scolding. These are all the emotional complaints, mind complaints that can come up in Pulsatilla. Okay, so we'll go ahead and we'll quickly look at the physical makeup. I told you it's a remedy prescribed for women. It's a remedy prescribed for women. So you see ladies who are usually good looking and blue eyes, pale face, anemic with chlorotic look. So generally it's a female remedy, good looking women, beautiful women. One can think of Pulsatilla, okay? And then you also have Pulsatilla. The thermals of Pulsatilla, they are, changeable, but mainly hot patient for practical purpose, or they can be chilly as well. So don't give too much of importance to thermals when it comes to Pulsatilla. So sometimes I feel cold, sometimes I feel hot. Okay, they're confused when you ask. They can be Pulsatillas. Okay, so this is the introduction. Now before I take up characteristic symptoms, we'll quickly look at what we discussed. I introduce a very important remedy both for students and for practitioners. It's a very important remedy. And we discussed that it's a plant. It's a very delicate plant. And that's why it's got this common and wind flower. It keeps moving as per the direction of the wind. It's not a firm plant. Right? One thing. The second thing we also saw is like it belongs to the family. And clover was talking about. Okay, one part. Now the important part is the sphere of action. And what we focused the first area was mucous membrane, and then we saw in general any mucous membrane you see pulsatile acting. One part. And second thing we also saw that it's a remedy acting on the eyes, ears, and of course we also saw the stomach, the lower bowels, and the kidneys, the male genitalia, the female genitalia. And in general we also saw that it has an affinity for veins. Good. So there is a clarity in this. And then we spoke of how do they look, and before that we also spoke of ailments and how exactly they look and what is the thermals. Okay. Now we look at the characteristic symptoms. After characteristic symptoms, I will give you a small break of 2 minutes and then we will continue with the remaining part of Pulsatilla. Okay. And what is characteristic is what we are trying to understand. So the first very important thing is pain. It's one of the important remedies for pain. Okay. Now, as a homeopath, when you're looking at pain, how do you decipher? I know I'm asking this for a first year student, but what remedies come to your mind and how each of them react in pain, all that becomes important. 3 days back I had a call. I was driving and one of the patients, she had called me and she had pain. And for that lady I prescribed Pulsatilla. Okay, I'll tell you why did I prescribe Pulsatilla. Okay. Now very important for you is, as a homeopath, when somebody is talking of pain, definitely we'll ask the character of pain, where is the pain, how is the pain, etc. etc. Now what do you do with pain? When you have pain, what do? You remember chamomilla? Okay, now what will chamomilla do when she's got pain? You have young girls with dysmenorrhea. Now if you have to prescribe chamomilla, what is it that you will be expecting in that girl? For you to prescribe chamomilla. How will she react when she is having pain? Okay, good, very good. Only anger? See, anger, irritability can be not from it. Okay, now what will chamomilla do? Huh? What is that uncivil behavior? You have to Google and see. uncivil behavior. Fine, Google will give you a lot of things. Fine, but what is it that you see in chamomilla? See, chamomilla, you're right, they're uncivil, they're angry, they're irritable, they can be snappish. Very important for you is, chamomilla will shriek, chamomilla will shout with pain. What is it? Chamomilla will shout, scream. Pains are unbearable in chamomilla. The nerves are very, very hypersensitive. So pain is something they cannot tolerate. One of the top remedies for pain is chamomilla. I had a lady whom I am treating for dysmenorrhea. 28 years old lady, or 30 years old lady. Brother is in Bangalore and she is in some village. And first time when brother brought her to my clinic, sir, she's got pains, etc., etc. And fortunately or unfortunately, when he was there, she had menses and she had dysmenorrhea. And he saw her agony, he saw her pain. So next visit he came to my clinic with her and he said, sir, please do something. Right? All this days I did not know that my sister is suffering so much. And she is screaming, she is shouting, she is, yelling, rolling. How old is she? 30 years old lady. Right? So this is more of chamomilla. One remedy, I would have given something else, but what I want you to understand is, this is chamomilla. Young girls, they scream. Fourth house neighbor will know that this girl has, every month, at this time she'll be screaming, shouting. But they'll not bother, because that is how the pains are. That is how the pains are. So shrieking with pains, many remedies, but top remedy is chamomilla. Now what will happen in Pulsatilla? They generally weep with pains. So I was driving, I was on the Bluetooth, when this patient of mine called and she was narrating her pain and she was almost in the verge of weeping. Her tone, doctor, pain, stomach pain, pain and I am not able to bear it and she is weeping. And the tone how they are talking. Pulsatilla's tone will be very pitiful. You as a driver, you as a doctor, you feel very sad for her. Okay. For example, if chamomilla would have caused that can bring some amount of anger and irritation in you. Right? You might tell, I am driving, please call me after some time. Because that might be irritating. But this Pulsatilla's voice, this Pulsatilla's lady that she was narrating, I did not feel any irritation. I genuinely felt she needs some kind of help and immediately Pulsatilla. See, for that lady also, chamomilla lady, if she calls, will not deny, will tell them chamomilla. You can take chamomilla or do something. But what I am trying to tell you is, this is how you homeopath realize. But in the voice, how is it? Today, 5:45 morning, I got a call from a person. Unknown person, he called. Sir, I saw your YouTube and I have a problem. What's the time? 5:45. So what do you understand? What do you understand from this? See, you don't tell, is this a time to call me? Right? Okay? Or you can say, at least ask what the problem is. I sincerely requested him to call after 8 a.m. Understood what his problem was, and then I realized it's not an emergency now. It's not an emergency now. He saw my YouTube at 5:45, and then he directs me and sir, so what is the issue? Sir, so many years I am suffering with mouth ulcers. How many years? So many years. Can't you wait for another 2 hours? You can. No, you can. So, but as a doctor, you need to understand he's a very anxious guy. And he's a guy who is looking for solution. He's desperate. So we're not, don't be angry with patients. Please understand as a homeopath what their state of mind is. So he's fed up, sir, I've taken all the treatment. He's coming from a very far off place. I can't go there, nor I can come here. Fine, but what I am trying to tell you is, he's desperate, and that is why at 5:45 a.m. with a problem which is there for so many years, he's calling me. Right? I asked call me after some time. And 8 o'clock when we spoke, we had a lengthy discussion, and we understood what his problem is. So what I'm trying to tell you is, as a homeopath, you need to realize who is Pulsatilla, who is chamomilla, who is arsenic, who is cinna. And unless you don't understand these constitutions, then life will become difficult. Tomorrow if you become a homeopath, if you don't understand who they are, it's not allopathy. Every patient, this is Dr. Honeyman who has introduced, and it is something individualized medicine. It is individual based medicine. So you have to be more sharp, you have to be more quick in understanding things. So we will come back. What I was trying to tell you is pains of Pulsatilla. Okay? They might resemble like chamomilla, but they're not that hyper, they're not that angry. They might scream, but you see a lot of weeping. Amma, I'm not able to bear, please do something. You can see that request kind of a thing. You use the word right, uncivilized, somebody used it here. Okay, yeah, it all applies to chamomilla, not to Pulsatilla. Okay, so Pulsatilla pains, a big thing taken from Alan Skinner. Pains come suddenly and appears, what is it? Disappears suddenly, or pains appear suddenly, comes gradually and disappears suddenly. One, and pains are accompanied with chills, great remedy, great pain remedy. Pain is shifting in character. This is what I want. Pain which keeps changing. Again, one more remedy. I told you, colchicum. We are eating colchicum, willingly or unwillingly. You also saw this in colchicum, pains which keeps shifting from one joint to another. Here, not necessarily one joint to another. It can be, sometimes I have pain here, sometimes I have pain here. Not necessarily joint. Shifting pains, pains which keeps changing. And pain is scheduled by pressure. Pain is aggravated by hot application, and people who weep with pain. Okay, and one beautiful clue I will give you. Children who weep with earache. Okay, if they are very cranky, irritated, chamomilla. If they are mild, Pulsatilla. Fine. Changeability of symptoms. Now this should have come first. Symptoms which keeps changing. Okay, which shifts from one place to another. See, even no two stools are alike. Pulsatilla, when she passes stools, it can be hard, it can be watery, it can be yellow, it can be brown. One stool, meaning, when she is going for a stool. No two stools are similar. That is also what you have in Pulsatilla. Okay, changeability, we see this very important. And one of the top remedies which are thirstless. Which are the other remedies? Gelsemium, Apis mellifica, Ethusa. Okay. Gels, Pulse, Apis, or Dr. Nash trios of thirstless remedies. Gels, Apis, Pulsatilla. Bioabsorption. Discharges are very important. From where did the discharges come up? Mucous membrane. We saw this under sphere of action. Acting on the mucous membrane, it causes discharges which are, increased discharges. Now I am giving you the character of discharges. When the discharges which are thick, yellowish, greenish, bland, B-L-A-N-D, bland discharges. So this is what you have in Pulsatilla. The only discharge which is acrid is leucorrhea. The only discharge which is acrid is leucorrhea. Okay. So discharges which are acrid and never well since puberty. From the time the patient has hit puberty, since then lot of problems. So till 12 years I had no issues. Once I attained menarche, all problems started. So never well since menarche is a beautiful tagline of Pulsatilla. Never well since menarche. And the discharges, the desires, they like more of, I told you, they like more of oily, masala, spicy, but unfortunately they cannot tolerate them. They like, but they cannot eat them. If they eat, they will end up with loose stools. So desires, bread, milk, And sleep, generally Pulsatilla, they sleep late, and morning they sleep more, they feel more sleepy in the morning. And the position of Pulsatilla is they sleep with their hand over the forehead. This is the position generally Pulsatilla prefer. This is how they sleep. Okay? So this is when they sleep. Okay. We'll take a small break of 2 minutes and then I'll continue with mind and we'll conclude with the particular symptoms. Okay. So once you come back, we'll quickly have a revision of the characteristic symptoms because that will help us in building up the particular symptoms. Okay. 2 minutes break and we'll continue with the